Healing back pain can be approached through a combination of self-care strategies, lifestyle adjustments, and in some cases, professional medical intervention. Here are several steps you can take to help alleviate and heal back pain.
Over-the-counter pain relief, non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen, which you might know as Advil or Motrin, or naproxen, commonly known as Aleve, can help reduce pain and inflammation. Just make sure to follow the dosage instructions, and if you have any concerns or chronic pain, it's really important to consult a doctor.
Gentle stretching and strengthening exercises. Stretching can be a great way to relieve tight muscles. Focus on areas like the lower back, hamstrings, and hip flexors. And don't forget about core strengthening. Exercises that target your core muscles, including the abdominals and back muscles, can provide much-needed stability and support to the spine. Maintain good posture. It's crucial to practice good posture while sitting, standing, and walking. Try to avoid slouching or hunching over, as this can strain the muscles and lead to pain.
Professional help.
A physical therapist can provide personalized exercises and techniques to improve flexibility, strength, and posture, tailored to your specific condition.
Chiropractors use manual manipulation techniques to align the spine and alleviate pain. This can be effective for certain types of back pain.
Massage therapy can help relax tense muscles and improve circulation in the affected area, promoting healing and pain relief. Acupuncture involves inserting thin needles into specific points on the body to alleviate pain and improve energy flow. It may provide relief for some individuals with chronic back pain. In severe cases, or when conservative treatments are not effective, doctors may prescribe muscle relaxants, corticosteroid injections, or other medications to manage pain and inflammation.
Prevention and lifestyle adjustments.
Engage in regular low-impact aerobic activities like walking, swimming, or cycling to strengthen muscles and improve overall fitness. Healthy weight management is key. Maintaining a healthy weight can significantly reduce strain on your spine and supporting structures. Ergonomic adjustments are essential. Make sure your workstation and home environment are ergonomically designed to support good posture and reduce strain on your back. Quit smoking. Smoking can impair blood flow to the spine and contribute to disc degeneration. Quitting smoking can improve overall spine health.
When to seek medical attention. If your back pain persists despite home remedies and self-care measures, or if you experience numbness, tingling, or weakness in your legs. Also, if back pain is accompanied by fever, unexplained weight loss, or bowel or bladder dysfunction, it's important to consult with a healthcare professional or specialist for a thorough evaluation and a personalized treatment plan tailored to your specific condition and needs.